right. Good morning, everyone. I am loving the chat messages that are coming through already from folks from all over letting us know where you're joining us from. My name's Rachel Browner. I am the program coordinator for OneOp, and it's my pleasure to welcome you to today's session on ethics of care and case management, communication boundaries, and best practices for providers. In case you're joining us for the first time, I'd like to give you just a brief tour of our webinar platform so you can find your way around. Hopefully, you're currently able to view the slides that we're sharing. If you're unable to see them or if you have any other difficulties, please email us at contact@oneop.org for tech support, and I'll place that email in the chat here shortly. As some of you've already done, we really look forward to having you join us in that chat pod for conversations and questions. To embed the chat pod so you don't miss any links or conversation, simply place your cursor over those shared slides. You'll see a toolbar pop up across the bottom of your screen. And from there, just click the chat bubble icon. And when typing questions or comments, please be sure to select everyone from the response options drop-down menu so everyone is able to view them in the chat pod. Note that the slides and resources are available for download on the event page for today's session. We'll be covering continuing education information at the end of the webinar, so please stay tuned at the end if you are interested in receiving CE credit or a certificate of attendance. We're offering a variety of CEs today, so please stay tuned at the very end as we talk about how you can access those. Thank you for joining us as we continue our partnership with the Department of Defense and the U.S. Department of Agriculture to expand that readiness, knowledge, and networks of the professionals supporting our military service members and their families. I'm excited today to introduce two of our presenters, our subject matter experts, all the way from New York today. I'm actually located in Texas. Miss Vivian Campagna and Miss Lee Riley are located in New York, but Dr. Vivian Campagna is the Chief Industry Relations Officer for the Commission for Case Manager Certification, focusing on certification-related partnerships, industry insight, and strategic alliances in case management. With over 30 years in the field across various settings like acute care and workers' compensation, Dr. Campagna is a board-certified case manager and a prolific author, speaker, and educator in case management. Her research emphasizes effective preparation and continuing education for case managers, as she's developed workshops, written industry trends, and advocated for client-centered workforce development. And Miss Lee Riley is a licensed clinical social worker and certified case manager who holds a BA from Mount Holyoke College and an MS in social work from Columbia University. She began her career in the AIDS program at St. Luke Roosevelt Hospital and later developed Emblem Health's first end-of-life care program, Dignified Decision. Transitioning to acute care, she directed social work for major New York health systems, leading initiatives like a hospice care program and the Enhanced Interdisciplinary Care Team for complex patient transitions, recognized at the 2018 Viziet Summit. And in 2020, she received the NASW Emerald Leadership Award, known for mentoring young professionals. Miss Riley now serves as the Director of Industry Relations and Education. We're really excited to have these two individuals providing a presentation for us today. If you have any questions or comments, we have several folks on from all over. Continue posting in that chat where you're joining us from if you haven't already done so, maybe what organization you're with. If you have any questions or comments throughout today's 90-minute session, please post them in the chat. That's our way that we'll be able to communicate. Note that if you have questions throughout the day or this morning, as we go through them, I may hold them towards the end. So in the last maybe 20, 30 minutes of today's presentation, we're going to have a time for Q&A. So please note, if you ask a question and we don't get it during the middle of the presentation, note that we are keeping record of it and we're going to make sure we answer those questions towards the end as well. So without further ado, Dr. Campagna, I'm going to turn over the presenter reins to you at this time.
Rachel, thank you so very much, and good morning to everyone. I see lots of people here from New York and from the tri-state area, but I see you from all over the country and from other places in the world as well. So this is very exciting for both of us. So just wanted to say good morning to you, and we can get started. Okay, so the learning outcomes for today's session will be to be able to apply at least two specific communication techniques to improve interactions with individuals with disabilities and their caregivers, to identify and articulate two strategies for maintaining appropriate boundaries, and to describe and apply an ethical decision-making framework to reduce ethical dilemmas. Our learning outcomes are a little bit out of order because we're going to start with ethics, but you will get all of it anyway. Okay, so ethics. What are ethics? Ethics are defined as a system of moral principles which affect how people make decisions and lead their lives. They're standards that guide behavior, both as individuals and as members of organizations. Ethics is the rightness or wrongness of an action, and it's concerned with what is good for individuals and society. They're often established within a community or a society, providing a framework for moral culture. Ethical principles are based on values. Values are what we accept as right or wrong. They're the core beliefs that guide and motivate attitudes and actions, and they're the source of our ethics. Values are very personal. Each person's values can be unique and may differ based on their background and experiences, and they will influence how one interprets and applies ethical principles in different situations. An example of a value is honesty. Based on the value of honesty, it would be considered unethical to lie or deceive someone. Ethics are generally found in codes, and codes of ethics are guidelines that are adopted by people or organizations that help to conduct actions and make decisions. There are two types of codes: a personal code, which is a set of personal ethical principles which guide your individual decision making, and a professional code, which is a set of guidelines for performance and evaluation based on core values and principles of a profession. If you think about it, you know that the Nursing Association has a code of ethics, the Medical Association has a code of ethics, the Commission for Case Manager Certification already also has a code of ethics for case managers. So, talking about ethics, we're going to talk a little bit about theories. There are several ethical theories that we're going to talk about today. Among them are deontological ethics, utilitarianism, virtue ethics, and care ethics. Care ethics is where we're going to focus, but we're going to describe a little bit of the others as well. Deontological ethics are duty-based. This is a moral philosophy that emphasizes acting based on an absolute based on absolute moral rules and duties. The belief being that there are absolute moral rules that apply regardless of the situation. In this case, the ends do not justify the means. For example, regardless of the number of lives at stake, deontologists would consider killing a terrorist as morally wrong because taking a life is inherently wrong. Utilitarianism or consequentialism is the ethical choice that maximizes overall happiness or benefits, often with a focus on outcomes. The belief is that the best outcome is the one that brings the most good to the most people. The end, in this case, justifies the means. For example, if a terrorist is holding hostages and the only way to stop them is to kill them, a utilitarian might justify killing as the morally right action because it would save lives. Virtue ethics, on the other hand, focuses on the moral character and virtues of the individual making the decision, rather than strict rules or consequences. It emphasizes cultivating good character traits like honesty, courage, and fairness to guide moral action rather than duty. A virtue ethicist would consider the motivations of the person considering murder, asking if they are acting with compassion, justice, or other positive traits. And then we get to care ethics. Care ethics prioritizes the interconnectedness of individuals within relationships and the responsibility to care for others and the context-sensitive nature of ethical deliberation that does not merely follow abstract moral rules. The focus is on the importance of relationships, empathy, and care in making ethical decisions. An ethics of care perspective would focus on the potential harm to the families and communities affected, urging for nonviolent solutions. Utilitarian is a form of consequentialism, meaning it judges actions based on their outcomes, while deontology focuses on the inherent morality of the action itself. Virtue ethics and ethics of care consider the individual's character and relationships within a community when making moral decisions, while utilitarianism often prioritizes the broader social impact. So let's talk about the ethics of care. The ethics of care is a moral framework. It emphasizes the importance of relationships, empathy, and the moral significance of care in human interactions. It contrasts with more abstract and rule-based ethical theories, such as deontology or utilitarianism, by focusing on the interpersonal dynamics and the needs of individuals within specific situations. It underscores the importance of compassionate care, client-centered approaches, and recognizing the real-world complexities of helping relationships. And that's where you guys are, is in helping relationships. So the foundational principles for the ethics of care include relational interdependence, which recognizes that individuals exist within networks of relationships that are integral to understanding ethical responsibilities, and emphasizes the mutual dependence and emotional connections that define human interactions. Compassion and empathy are moral actions that should be guided by a deep understanding of others' experiences and emotions. Emotions like empathy, compassion, and sensitivity are viewed as vital to moral reasoning, enabling individuals to understand others' perspectives and foster trust and care. There is also the holistic approach to well-being. Ethical care goes beyond physical needs to include the emotional, physical, and social well-being of a person. A person-centered approach ensures that all aspects of an individual's life are considered. The framework is particularly relevant in fields that involve caregiving or interpersonal engagement, in many cases, such as medicine, social work, nursing. Some examples. Core elements of the ethics of care are relational interconnectedness. Relationships are central to human existence and moral reasoning. Ethical actions are understood within the context of those relationships, emphasizing the value of fostering trust, compassion, and mutual respect. Attentiveness is being attuned to the needs, emotions, and circumstances of others. Ethical care requires noticing and understanding the needs of those who may be vulnerable or dependent. Responsibility is recognizing and accepting a moral obligation to respond to the needs of others, particularly within close relationships or caregiving roles arising naturally from those relationships. Competence is effective care that involves not only good intentions, but also the skills and ability to meet the needs of others. Emotional engagement is an element that emphasizes that moral reasoning should involve both cognitive and emotional processes. Contextuality is that ethical care recognizes that every situation is unique and requires a nuanced understanding of the specific circumstances, relationships, and cultural factors involved. Universal or rigid rules are de-emphasized, again, going back to the deontological or the utilitarian. And mutuality, ethical care fosters growth, trust, and understanding for both the caregiver and the care recipient. So to compare the ethics of care to traditional ethics, the ethics of care stands in contrast to those ethical frameworks offering a relational and context-sensitive approach to morality. Here's a comparison of the ethics of care and traditional ethics. The key values of ethics of care are relationships, empathy, compassion, responsibility, interconnectedness, all in contrast to traditional ethics whose key values are fairness, autonomy, rights, duty, and consequences. In ethics of care, the approach is contextual and relational, with moral decisions depending on the relationships and specific situations, in contrast to being universal and principle-based. Moral decisions in deontology follow predefined rules, or in utilitarianism, outcome-based calculations. So there's a contrast there. A criticism for the ethics of care includes the potential subjectivity, lack of clear universal principles, and being historically associated with feminist ethics, again, because of the caring and nurturing role that it takes, suggesting it reinforces traditional feminine roles of caregiving. It's the traditional ethics are criticized for being too abstract, too impersonal and rigid, ignoring individual relationships. Some of the strengths of the ethics of care include that they prioritize real human relationships and emotions over abstract concepts, emphasizing human connection and responsiveness to the needs of others, and can be adapted to specific situations. Whereas traditional ethics provide clear moral guidelines and consistency in ethical reasons, in some cases, just being very black and white, no shades of gray. Limitations include that it can lead to favoritism, it can lack a clear decision-making framework, and it may struggle with fairness-based dilemmas, whereas traditional ethics can be too rigid, deontology, or too consequentialist, utilitarianism, overlooking care and personal relationships. Again, some of those cases, everything is black and white with very few shades of gray. They're focused on moral responsibility based on care and relationships, whereas traditional ethics focus on moral responsibility based on rules, rights, or consequences. The ethics of care ultimately champions a compassionate, relationship-driven approach to ethics, valuing empathy and attentiveness to individual needs in social contexts. And the ethics of care are best applied in healthcare, social work, caregiving, family, and close-knit communities, and professions that require deep interpersonal engagement, in contrast to traditional ethics, which are more applied to law, policymaking, business ethics, and any context requiring impartial and consistent moral reasoning. So let's talk about ethical principles. There are 4 of them that are here. These are the main ethical principles. There are a number of other ethical principles out there in the community, but we're going to talk about these 4. Autonomy. Autonomy is respecting the client's right to make their own decisions. It is the ability to self-determine a course of action and to support that independent decision making. There is a respect for the client's dignity, rights, and values should guide all interactions. All encounters should be person-centered, allowing for maximum appropriate autonomy and participation in decision making. Again, everyone has the right to make their own decisions, even if it's a bad decision in your eyes. Beneficence is to do good, acting in the best interest of the client and promoting their well-being, considering their individual goals, needs, experiences, background, religious beliefs, and experiences. Non-maleficence is to do no harm, avoiding harm or injury to the client. This principle establishes that it is up to us to be mindful of the consequences of our actions and to refrain from decisions that could harm others. And the final principle is justice. It's the ethical principle that involves the idea of fairness and impartiality in terms of access to resources and treatment. When you're faced with an ethical dilemma, using these 4 principles to apply an ethical decision-making framework helps you to systematically evaluate the moral aspects of a situation and make a decision that is justifiable, ethical, and appropriate. Understanding how to mitigate a situation and complex moral issues and make ethically sound decisions can help to mitigate stress and moral distress in yourself. And it's important to understand that sometimes these principles do conflict. Beneficence to do good and non-maleficence to do no harm. Sometimes doing good means doing harm. Think about the cancer patient who's getting chemotherapy, who winds up being very sick after a treatment. You're doing good, beneficence, because you're giving them treatment to cure their cancer or to treat their cancer. But in some ways, it's non-maleficence because you're still doing some harm because they're not feeling so great, although the expected outcome does fall under beneficence. So why do humanized frameworks matter? Well, a humanized framework is an ethical decision-making approach that prioritizes human values, dignity, and well-being above all else. often placing a strong emphasis on empathy, compassion, and considering the impact of actions on individuals rather than solely focusing on abstract principles or outcomes. They essentially aim to make ethical decisions by considering the human experience at the core of decision-making process. Key reasons why human rights frameworks are vital is because they emphasize the importance of compassion, empathy, and understanding in decision making. These frameworks recognize that people are not isolated individuals making decisions in a vacuum, but a part of social networks, relationships, and communities. They emphasize vulnerability and interdependence, acknowledging the vulnerability and emphasizing the moral responsibility to care for others. Traditional frameworks like deontology and utilitarianism often prioritize rational reasoning and rule based ethics. While these are important, they can overlook the importance of emotions like empathy, compassion, and caring. Keep repeating those same words in ethical decision making. Humanized frameworks incorporate emotional intelligence into moral reasoning, allowing for more holistic, nuanced decisions. Ethical decisions are often made in complex, diverse environments where there are no clear cut answers. Humanized frameworks take into account the complexity of human lives and relationships, leading to more thoughtful and flexible ethical decision making. By focusing on long term relationships, care, and emotional support, humanized frameworks prioritize well being over short term results, in contrast to ethical systems that might prioritize efficiency or outcomes over the enduring welfare of individuals and communities. Humanized frameworks encourage holistic practices that account for the full complexity of people's needs, emotions, and circumstances. They matter because they help ensure that ethical decision making is grounded in real world human experiences, relationships, and needs. By embracing values like empathy, care, vulnerability, and social interdependence, these frameworks create more equitable, compassionate, and effective systems across various sectors. They foster environments where individuals and communities are valued not just for their functional roles, but for their inherent dignity and interconnectedness. In this way, human frameworks contribute to the well being and flourishing of individuals and society.
Dr. Campagna, how
Yes,
does these traditional rational frameworks work with that humanized framework? Can you explain that a little bit more?
the traditional frameworks are very, very kind of structured. Obviously, if you're deontological, you think that there is one right way and one wrong way. Um, in the example that we gave earlier of the killing of a person, you have someone who's holding hostages. And of course, the deontologist would feel that the only way to save lives of the people that are being held is to kill the hostage taker. Um, in that sense, we're not considering the humanness of the hostage taker. We're only considering the fact that they are a threat and therefore they have to be neutralized. In humanized frameworks where there is compassion, the hostage taker may have reasons for having taken those hostages. Do we consider what his reasons are? Are they reasons that we might consider to be somewhat um, viable in the sense that there would be, you know, a good reason if we could diffuse the situation, kind of get the hostages away, get the person down, take care of him individually, and yeah, it may mean bringing him to jail and the whole bit. But there are considerations that are made in humanized frameworks that are not made in traditional frameworks because it's really basically black and white. Is there a reason for why we need to do something that might be considered unethical, but the reasons outweigh the ethical choices we have? So the traditional frameworks, again, you want to make sure that you diffuse the situation, you get that terrorist out of there, and you get the hostages back to safety. The utilitarianism says, well, okay, maybe if we kill one person, it might be okay because we're going to save for the greater good. But in humanized frameworks, we consider the person. We consider all of those people, not only the hostages, but we also consider the hostage taker because there is a person there. We have to think about what are the human characteristics and things that are going through his mind. How do we provide compassion? So, dichotomy because in a traditional framework, there is no compassion. In the humanized framework, there is compassion. Hope that answered the question.
Yeah, and then is the humanized framework versus the rational framework the reason there are different approaches to like incarceration and the penal system, for example?
Absolutely. Absolutely. And remember, everybody's code of ethics is different. And a code of ethics can change. In one situation, you may have a code of ethics, or your ethics may be very deontological. There is only one right answer. If I'm in that situation where I'm a hostage, I want that terrorist taken down. But normally, I might be a very ethics of care person and say, well, they had reasons for doing it. They didn't understand. Maybe they were um, just in a point of stress. And so let's see what we can do to kind of work with them. So it, it's very interesting how ethics can kind of go back and forth in us at times. And I'm not sure that I answered that question.
Thank you.
Okay. All right. So moving right along, we are going to talk about, did I might have passed a slide. Okay. So, in case management, the application of humanized ethical frameworks, such as the ethics of care, can significantly enhance the quality of service that we provide to individuals. Case management is about assessing, planning, coordinating, and advocating for the services that individuals need to address their health, social, or psychological issues. Applying a humanized ethical framework ensures that the process is centered on the individual's needs, experiences, and dignity. Again, individuals. Key applications for the ethics of care include emphasizing the importance of viewing clients as individuals with unique needs, values, and experiences, taking into account all of what makes up a person. It's their culture, it's their heritage, it's, their values, their wants, their desires. The ethics of care stresses the importance of trust, empathy, and mutual respect in relationships. Humanized frameworks such as the ethics of care prioritize a holistic approach to understanding individuals within their broader social, cultural, and economic contexts. It emphasizes respect for the inherent dignity and autonomy of individuals as well, ensuring the clients have a say in their care and decision making. Humanized frameworks recognize the complexity of decision making, especially when multiple needs or perspectives are at play. And the application of these frameworks ensures that care is compassionate, individualized, and responsive to the complexities of each individual situation. By focusing on empathy, collaboration, advocacy, and respect for autonomy, we can provide more effective, holistic, and person centered care, leading to better outcomes and improved quality of life. These frameworks also encourage us to continuously evaluate and adapt their approaches in order to meet the evolving needs of the individuals we serve. So I'm going to move on a little bit to emotional intelligence because that's going to lead us into the communication piece of the ethics of care and how to deal with the clients and the caregivers that you work with. So emotional intelligence is the ability to recognize, understand, and manage our own emotions as well as the emotions of others. Emotional intelligence, or EI as I will refer to it, is especially important because it enables us to build rapport with clients and caregivers, offering support during difficult times and handling the stress and complexity inherent in care. It allows you to navigate complex interpersonal dynamics. By developing and applying emotional intelligence in yourself, you can foster better relationships, improve communication, and enhance the client-caregiver relationship. There are 5 components to emotional intelligence. Each of these components plays a vital role in how you interact with clients and caregivers, and ultimately contributes to more effective communication, trust building, emotional support, and conflict resolution. The first is self awareness. Self awareness is the ability to recognize and understand your own emotions and how they affect your thoughts, behaviors, and your interactions with others. It allows you to stay grounded and focused, even when you're in a stressful or emotionally charged situation. It's about developing a straightforward and honest understanding of what makes you tick. The ability to monitor your emotional triggers and recognize when you're feeling frustrated, anxious, or overwhelmed gives you the ability to take a moment to pause before you respond. And then afterwards, reflecting on your reactions, did you remain calm and empathetic? If not, what could you do differently next time? And we can all develop emotional intelligence. It depends just on how strongly you feel about trying to pull yourself into the emotional intelligence to understand yourself. The second piece of emotional intelligence is self regulation. Self regulation is what happens when you act or do not act, and it's dependent upon your own self awareness. It's your ability to use your self awareness of your emotions to stay flexible and to direct your behavior positively. This means managing your emotional reaction to situations and people, staying in control of your emotions so that they don't dictate your actions. Something happens, you feel that you're getting very frustrated, very angry, and your first thought sometimes is to just strike back at the person who's creating that stressful situation for you. If you can self regulate, pull yourself back, pause before you react, model calmness, because you have the ability to stay calm, you can diffuse some of those difficult conversations or difficult situations, but you have to be able to self regulate. Self regulate, of course, is built upon the fact that you are aware of what your triggers are. The third piece of emotional intelligence is strong social skills. Social awareness is your ability to pick up and understand the emotions of others. You're able to read the room, you're able to read the people that you're with. This often means perceiving what others are thinking and feeling, even if you don't agree. It's easy to get caught up in your own emotions and then ignore the needs of others. Listening and observing are the two most critical elements of social awareness. In order to listen and observe well, we must stop doing many things that we enjoy doing, like thinking about, okay, you said something I didn't really like. I'm thinking about my response to you instead of listening to the rest of what you're saying. Social skills tell you, no, I have to finish listening to you and then think about my response before I react to you because that is emotional intelligence. I am an emotionally intelligent person. The fourth is empathy. Empathy is the ability to recognize, understand, and share the feelings of others. It's about connecting with people on an emotional level and understanding their perspectives and then offering appropriate support. Emotional empathy is when you feel physically along with the other person as though their emotions were contagious. And there's a very good YouTube video that is by Dr. Brene Brown on empathy versus sympathy. If you want it, I can send the link for it, but it's really good because empathy and sympathy are definitely very different. And you really need to understand the difference between empathy and sympathy and how to apply it. Empathetic communication builds trust, and it's essential for effective collaboration in planning and decision making. So you want to listen actively. Again, empathy is listening actively, acknowledging the emotions, pay close attention to what people are saying, and then you're able to react. And the last piece is motivation. It's the ability to harness emotions to pursue goals with energy and persistence. It involves being driven by more than just external rewards, but also by internal values and a commitment to achieving positive outcomes. When you're motivated, you bring energy, enthusiasm, and a commitment to high quality care, which can inspire the individuals and the caregivers you work with. Motivation helps you stay focused on the long term goals for those clients, even when immediate results may not be visible. That helps your clients to set clear, meaningful goals that will support their autonomy by motivating them to take charge of their situation in manageable steps, manageable, and allow them to understand the long term benefits of the plan, encouraging them to stay engaged. So, key aspects of EI include to know your values, What are the values that are most important to you that you will not compromise? To hold yourself accountable by admitting the mistakes that you make with emotional intelligence and to face the consequences, and to practice being calm by being aware of your responses in challenging situations. Practice deep breathing. Think about what you're going to say before you say it. The more you can develop emotional intelligence, the more you can help the people that you're working with. And now I'm going to turn this over to Lorna, and she's going to pick up on communication.
And thank you, Vivian, and welcome everyone. And the next few slides, I will be reviewing communication, communication styles, and tips for effective communication. So what is communication? Communication defined is a process through which information, ideas, and emotions are exchanged. To communicate effectively, we need to understand how our communication skills affect the assessment and engagement of our clients, and to modify our communication style when considering factors such as age, capacity, learning, and physical ability. These considerations include both verbal as well as nonverbal exchanges, such as speaking, listening, body language, facial expression, and even written communication. So, intentional communication and communication strategies are crucial components in communication in improving the quality of the interaction between you, your client, and the caregiver. So let's talk a little bit about effective communication. Effective communication educates, enables, and eliminates the threat of the message that is being imparted. It involves sharing ideas and meaning using common systems of symbols, signs, and behaviors, and the use of verbal, nonverbal, written, and electronic means that are modified to meet the client's need. Effective communication is a two-way process, interactive process. It's a two-way interactive process with the goal of ensuring the communicator and the receiver gets the same message. On the other hand, ineffectively used, communication can create fear, confusion, and anxiety, resulting with resistance from your client. When people think about communication, they think about talking. However, communication is both verbal and nonverbal. So, what is verbal communication? Verbal communication is an agreed upon and rule governed system of symbols used to share meaning. It's about language, both written and spoken. It's how we use words. Nonverbal communication is the act of conveying information without the use of words. It's facial expressions, gestures, body language, tone of voice, silence, and other physical indication of mood, attitude, and so forth, some of which may be rooted in the person's culture or subculture to understand. Body language can speak louder than any words. Whether you're telling people that you love them or you're angry with them, body movements reveal your thoughts, moods, and attitudes. Both consciously and subconsciously, your body tells the observer what is really going on with you. So let's look a little bit about effective communication. Talk a little bit about effective communication tips. Complex terms and technological jargons can create confusion, especially with clients or caregivers with limited knowledge. Modifying your communication style will help overcome literacy barriers. Using plain language can improve understanding, reduce anxiety, and helps clients and caregivers feel more in control of their decisions. Maintain appropriate eye contact without staring to show engagement. Use an open posture. Avoid crossing arms to appear approachable and non-judgmental. Mirror the client's or caregiver's body language, subtly of course, to create rapport. Nonverbal cues can enhance the message being communicated and create a more comfortable, trusting environment for both the client and the caregiver. And sometimes, especially in complex situations, it's helpful to pause and summarize key points of the conversation and clarify any misunderstanding. This ensures that you and the client or caregiver are on the same page to ensure that the outcome is mutual. Clarification and summarization reduces the risk of misunderstanding. It gives the client and caregiver an opportunity to correct any miscommunication and reassures them that their concerns are being heard. It is highly recommended that you use interpreter services for the client's caregiver preferred language if indicated. Using family members or the caregiver to translate is not recommended. And setting the right tone early in the conversation can have a huge impact on the effectiveness of the communication. You can do this by choosing your body language and tone of voice carefully and employ interpersonal skills such as sitting at the same level as the client or caregiver to avoid creating a power imbalance, and speaking calmly and at a measured pace, especially when explaining something complex or distressing. This works to help establish a non threatening, compassionate environment, encouraging clients and caregivers to open up and engage in the discussion. So, intentional communication goes beyond just conveying information. It's about purposeful, clear, and aware of how the message is delivered and received. Intentional communication helps foster trust, ensure understanding, and demonstrate empathy, which are essential for a positive provider client caregiver relationship. As you can hear, the common theme is empathy. With intentional communication, you will approach each conversation with a clear intention. The message should be framed with purpose and clarity. It allows you to consider your audience and tailor your communication to the needs of the client or caregiver. The focus is on understanding to ensure that the client or caregiver not only receives the information, but understands it. It's not enough just to give information. Verify comprehension. Being present in the moment, actively listening, and showing understanding will build a strong, trusting relationship with clients and their caregivers. Use reflective listening. This involves reflecting what the client or caregiver says to ensure accurate understanding and to make them feel heard. For example, you might want to say, "What I hear you saying is that you are worried about," and state what you heard. Let's talk a little bit more about this. The primary rule of intentional communication is to think before you speak. In other words, practice developing mindfulness about what you say, as well as when, how, and why. Think about what you intend to get from the conversation. Learn as much as possible about the problem or the concern. Make a conscious decision to be present for the conversation. Commit to giving your undivided attention by being mindful of your body language and tone of your voice. The wrong tone of voice, as perceived by the recipient in the conversation, can send a negative message instantaneously. And also watch your words. While body language convey most of our communication, words still matter. Connect on a more personal level. The next thing is awareness. Notice what you are feeling in all of your communication. Are you emotional? Are your emotional response appropriate to the context of the communication you are having in the present? Or are you dragging some emotional baggage into the moment? Example, I'm going to share an example of a case to illustrate some of the concept we just talked about. So this is a case of Lisa is a case manager and she's working with a mother of a young adult who's Jake, who has developmental disability and requires support in transitioning to an independent living situation. Lisa wants to ensure that Jake's mother feels heard, informed, and included in the decision making process while respecting Jake's autonomy. So, in this scenario, Lisa sets the stage by ensuring that they are in a safe and comfortable space to protect privacy. Lisa reinforces the mother's role by validating what she does, by saying, I appreciate all the care and advocacy you've provided for Jake. Your insight are invaluable as well as we work together on this transition. Lisa then will allow time for the mother and Jake to talk about what it is that they are looking for and what goals they would like to set. So, in this instance as well, Lisa, the mother might express anxiety and concern about her son transitioning to independent living. So Lisa, it's important for Lisa to validate the mother's feelings and allow her time to express what her concerns are. And she could say, it sounds like you're worried about how Jake will handle budgeting and self care without daily oversight. And that's completely understandable. Lisa ensures that both Jake and his mother are involved in the decision-making process by asking, what are your thoughts on these ideas? What kind of support do you feel would be most helpful? And Lisa reassures them, both the mother and Jake, will make sure the plan is flexible so you can stay involved while allowing Jake to gain independence. Before the meeting ends, it's very important for Lisa to summarize the discussion and outline next steps and goals that were discussed in the meeting. She could say, we'll start by connecting you with both a transition specialist who can help with life skills coaching. It follows and follow up with a 2 week and follow up in 2 weeks to see how things are going with both of them. By using intentional communication, active listening, validation, and collaboration, Lisa fosters trust, ensures mutual understanding, and support both Jake and his mother in navigating the transition effectively. We're going to talk a little bit now about active listening. So, active listening involves giving your full attention to what is being said without interrupting. It encourages an open, honest dialogue and can provide valuable insight into the client's or caregiver's concern. It promotes trust and helps uncover hidden concerns. It allows the person on the other side of the conversation to feel that their experience and worries are being acknowledged. Active listening involves using open-ended questions. Open-ended questions allow clients and caregivers to express themselves more fully and help you gain a more complete understanding of the situation. Here are some examples of open-ended questions. Can you tell me more about what you're experiencing at home? How do you feel about the plan? What concerns do you have about caregiving at this stage? These questions encourages conversation rather than yes/no responses and help uncover critical details about the client or the caregiver's experience. The art of listening is underappreciated but important skill that utilizes three fundamental principles, which are pause, prompt, and prompt emotion. So I'll talk a little bit about each of these three P's. Pause. By slowing down, you allow time for the other person to speak and state what is on their mind. while you are present and listening, not formulating your response. Prompt invites the other person to say more. This demonstrates that you are interested in listening, asking open ended questions, or making gentle suggestions encourage the person to share more about their feelings, thoughts, or concerns. This goal is to guide the conversation in a way that helps the person express themselves further without feeling pressured. Types of prompts can be nonverbal cues such as eye contact or nod, or inviting hand gestures. Single words such as uh-huh or or what, how will encourage engagement. To elicit more information, try using words or phrases such as what happened next, or you may know about this one. Please tell me more. Prompt emotion, acknowledging emotions, how terrible, how frustrating, helps the person to articulate their thoughts. Allowing the person to express frustration helps to diffuse it. Acknowledging and validating the client's emotional state and encouraging them to express their feelings reinforces empathy and supports the emotional well being of the client. And paraphrase. Reflect back to the person what you have heard them say. It's important to use some words to paraphrase effectively. Ensure that you have heard correctly. Affirm that you have been paying attention. Allow them to explore what they are thinking in more depth. For example, I can hear that you're feeling really overwhelmed by the news, or it's completely normal to have those feelings, and I'm here to support you through them. This response not only acknowledges the client's emotions, but also reassures them that it's okay to feel how they do. Fostering an open, compassionate relationship is key. And pay attention. Look at the speaker and clear distracting thoughts. Many times we are only partially listening as we are trying to formulate our response. Don't think about what your response will be while the other person is speaking. Avoid distraction in the environment, such as radio, TV, or other forms of distraction. Show that you are listening by using verbal and nonverbal cues, and provide feedback. Reflect on what is being said to weed out your own assumptions, judgments, and belief. Say to the speaker, sounds like you're saying, or what I'm hearing is, or ask for clarification when indicated. Is that what you mean? Summarize the content of what you've heard to ensure your understanding of the issue is correct. And by all means, do not judge. Do not interrupt. Allow the speaker to finish each point before asking questions and avoid counter argue. It only sets up resistance from the other person and generate frustration for both of you. Respond appropriately. Active listening encourages respect and understanding. Be candid, open, and honest. So the next few slides, we will be reviewing our boundaries, and these are really essential to helping you manage stress and burnout. So what are boundaries? Boundaries are the limits you set to protect your personal and professional well-being. They define the way in which you engage with others, including how much emotional, mental, and physical energy you share, and how you protect your time, space, and self esteem. Establishing and maintaining healthy boundaries, both professional and personal, are crucial to ensure the relationship with your client and caregiver remain effective, compassionate, and sustainable. Without clear boundaries, you risk burnout, stress, and compromised care. Let's discuss the two types of boundaries. First, you have your personal boundaries, and they are the physical, emotional, and mental limits you use to protect yourself from being drawn into too much of your clients' lives and from being manipulated or violated by others. They allow you to maintain psychological safety for you and your clients. You can make objective decisions about the therapeutic process to most effectively assist your client to achieve their goals. Without these personal boundaries, you can run the risk of getting too involved in your client's issues and wanting to rescue them from their situation. While workers cannot rescue their clients, they can work with your clients to help them achieve their goal, which may include supporting them to change their situation. Now, professional boundaries are the legal, ethical, and organizational framework that protects both the client and the worker from physical and emotional harm and helps to maintain a safe working environment. Sometimes we encounter challenging situations which can make maintaining these boundaries difficult. For example, if a client offers you gifts or invites you to a social function or wants to extend your relationship beyond the service provided, such as being a friend, or divulge information which is not relevant to the therapeutic goal. Situations such as these require you to have a clear understanding of your role and ethical principles and the organization policies and code of conduct. It is also important for you to be clear and assertive with clients about the boundaries of your role and what is appropriate behavior. It is also important to consider the following types of boundaries to mitigate stress and burnout. Time boundaries. Set specific work hours and personal time. Avoid checking work related emails during off hours and stick to a set schedule that allows time for self care. Emotional boundaries. Determine how much emotional energy you are willing to invest in your client's relationship. If a client or caregiver demands more than you can give, it's okay to refer them to another resource or to set limits on how much emotional involvement you can have. Physical boundaries. It is crucial to establish guidelines around physical touch and personal space. Communicate to your client and caregivers that you are there to provide care, but need to respect personal space. And mental boundaries. Respecting cognitive load and limiting involvement in others' problems are emotional stages that may be overwhelming. Maintain a clear line between the personal and the professional aspect of your relationship with clients and caregivers at all times. So, the importance of boundaries are as early as possible in the relationship, establish clear agreement regarding your role, your availability, and the best way to communicate with you, and what to do if you see each other in public settings. When boundary issues appear, address them quickly and clearly being sensitive to your client's feelings. Perception is truth to the eye of the beholder and must be dealt with quickly and sensitively. If you disclose personal information, please make sure it is relevant to the client's goals. Too much self disclosure shifts the focus from the client to you and confuse the client's understanding of the relationship. It might be necessary to frequently clarify your role and boundaries to ensure the client's understanding. Use your supervisor or professional colleagues as a sounding board if you have questions or concerns regarding an encounter with a client. And a little bit about dual relationships. Dual relationships are when you and the client may know each other from another setting, either prior to or during your involvement with them. This creates a blurring of the lines between the work and the non-work relationship. If you had a social relationship with a client prior to becoming a service provider, you must consider how future interactions will impact the client's confidentiality and the physical and emotional security. Keep your relationship professional. Having both a professional relationship and a personal friendship with a client at the same time can make it difficult to maintain boundaries and a safe and appropriate working environment. And it may just be best to remove yourself from the situation and have the client assigned to another colleague. By maintaining healthy boundaries, your client is encouraged to be independent, taking responsibility for their own progress rather than becoming overly dependent on you. Boundaries foster self-efficacy and empowerment in the client. Clients understand what to expect, which reduces confusion and frustration, also creating a sense of stability and reliability. Boundaries are, boundaries also ensures that the relationship remain professional and enhancing trust. The client experience safe, the client experiences safety knows that you support them without personal entanglement. They are least likely to experience confusion or emotional distress caused by mixed messages, allowing the relationship to be structured and professional and enabling them to focus on their goals rather than unclear personal dynamics. So we'll talk a little bit about maintaining professional and personal boundaries. Setting clear expectation at the beginning of the relationship helps to mitigate the potential for problems later on. Describe your role, as I mentioned earlier, and what they can expect from you. Describe what you expect from them in terms of acceptability, acceptable behavior, mutual respect, and a commitment to the process. Maintaining a professional attitude will prevent the client from becoming too friendly, blurring the lines between the professional and the personal working environment. Address boundaries issues quickly and clearly, again, being sensitive to your client's feelings. Avoid sharing personal information and avoid asking for information that is not relevant to the process. If you do disclose personal information, make sure it is relevant to the client's goal. Follow through on commitments. If you promise to follow up on something like make a referral or call the client back, be sure to follow through in a timely manner. Reliability fosters trust. Always maintain objectivity as well as protecting the client's privacy and confidentiality. Be self aware. Recognize and understand your triggers. Engage in self reflection. Critically examine your work and seek feedback and advice from your colleagues and supervisor when you identify that you are in jeopardy of blurring the boundaries. Maintaining boundaries enables you to provide objective, client centered advocacy and prevent conflicts of interest or the perception of favoritism. Keeping a professional distance allows you to make decisions in the client's best interest. So let's talk a little bit about some of the boundary violations. So recognize signs of boundary violations, whether personal, emotional, or professional, can help you intervene before things get out of hand. Here are some common signs. Emotional overwhelm or drainage is when you are feeling constantly overwhelmed or exhausted after interaction with your client or caregiver. Having a sense of emotional detachment or becoming overly protective and defensive in your interaction. experiencing excessive empathy or over-identification with a client or caregiver's emotions or situation, leading you to feel as if their problems are your own. Difficulty saying no, feeling guilty or uncomfortable when turning down requests from clients, caregivers, or coworkers, even when it's outside your scope or availability, and consistently overextending yourself because you feel obligated to do more than is reasonable or sustainable. And physical symptoms are frequent physical illness, headaches, stomachache, fatigue that seems to be linked to stress. A common symptom is disruptive sleep pattern or having trouble relaxing or unwinding, experiencing muscle tension or a sense of being on edge due to feeling emotionally or physically drained, increased conflict, feeling frustration, irritability, or resentment towards your client, caregivers, or coworkers because you feel your boundaries are being disregarded. Difficulty in maintaining a professional demeanor when responding to clients or caregivers' requests, especially when it feels like their needs are taking precedence over your own. And role confusion is taking on tasks or responsibilities that are outside your role or job description, often in an attempt to help, but at the expense of your own well being. And feeling compelled to provide personal advice, becoming a confidant, or solving problems that should be handled by other professionals. Feeling confused about the appropriate level of closeness or familiarity with clients or caregivers, and developing blurred boundaries in your relationship when the lines between professional and personal interactions become unclear or compromised. These signs include you and your client begin referring to each other as friends, receiving gifts from or giving gifts to your client, sharing of home phone numbers or other significant personal information, asking or expecting socialization outside of the professional setting. You reveal excessive personal information to your clients, or they reveal personal information that is not necessary to the professional role. Discussion regarding work client dominates your social interaction with friends and family, and you find yourself offering to provide assistance to client outside of your professional role. So the next thing we'll talk about consequences of poor boundaries. If boundaries are not identified and maintained, it can lead to significant negative consequences for both you and your clients and caregivers. These consequences can be immediate or build over time, affecting job satisfaction, care quality, and well-being. When boundaries are constantly violated or unclear, it can lead to physical, emotional, and mental exhaustion, also known as burnout. Providers who do not set limit on demands placed on them can experience burnout, resulting in lack of motivation, diminished energy, and a sense of being emotionally spent. Burnout can lead to detachment, cynicism, and a loss of interest or disengagement. The result is reduced empathy and poor client outcomes because you are no longer fully present or invested in the work. And compassion fatigue is emotional numbness or feeling emotionally drained after interacting with clients or caregivers. This happens when emotional demands outpace your ability to regenerate emotionally, leading to diminished capacity to feel empathy and avoiding or distancing yourself from situations. If you are emotionally exhausted, distracted, or overwhelmed, your ability to make clear, effective decisions may diminish. This could lead to mistakes, poor judgment calls, or a lack of attention to your client's needs. When boundaries are not clearly communicated, clients and caregivers may have unrealistic expectations about the level of care, service, or attention you can provide, leading to dissatisfaction, frustration, or resentment on both sides. Lack of personal time, work life balance, where your personal life consumes, I'm sorry, where your professional life consumes your personal space and increasing stress, leaving you little time for relaxation or connection with loved ones. Other consequences can include compromise, ethical practice, and ethical dilemmas, leading to questions about your reputation and integrity. Trauma can be experienced on both sides of the relationship, leading to physical and psychological problems. So now we're going to talk a little bit about self-care, but to do that, let's discuss burnout. Burnout and stress are prevalent due to the emotional, physical, and mental demands of the profession. Recognizing the signs early can help prevent it from escalating, allowing you to take proactive steps to protect your well being and maintain the quality of care that you provide. Here are some key signs of burnout and stress. Emotional signs of burnout: feeling constantly overwhelmed by your workload, feeling like you'll never be able to catch up, having persistent feeling of being emotionally drained, you no longer find joy or satisfaction in your work, you become easily frustrated or irritated, and you're lacking empathy and feel detached or indifferent. Physical signs: constantly feeling of tiredness or fatigue, sleep disturbances, poor concentration, lack of energy, muscle tension, poor appetite are all signs of physical burnout. And cognitive or behavioral signs are difficulty focusing, making decisions, or remembering details, decrease in overall productivity and effectiveness at work, procrastination, feeling disengaged, bored, and resentful, seeking use of caffeine or alcohol or other substances in order to cope, while stress is caused by too much to do, burnout is caused by never enough time to get it done. It is essential to state it is essential state of your emotional, physical, and mental exhaustion caused by prolonged stress or overwork. Burnout is preventable and reversible. Practicing self-care is crucial for preventing and managing burnout. So I'm going to hand it back over to Vivian, who will then wrap up with some stress management as well as resilience.
Thanks, Lorna. So we all know about what causes stress, and we all know about, how to recognize the signs and symptoms, but sometimes we need to be reminded. So to prevent yourself from burnout and manage stress effectively, you have to, you prioritize self-care and recognize your stressors. Self-care strategies to be aware of the signs and symptoms, which include increased levels of stress. They can be physical, emotional, and behavioral. Remember one thing: self-care is not selfish. It's essential in order for you to build resistance and well-being. Find activities that recharge you, set boundaries to protect your time and energy. Strive for work-life balance. Disconnect when possible. Allow for rest and relaxation during the day, even if you take 5 to 10 minutes to just take a walk, do a little bit of mindfulness, and recharge. Eat a balanced diet because food impacts mood and energy levels. Practice good sleep routines. Create a restful environment. Set achievable goals. Practice time management. Take advantage of your time off. We all have time off. We all get vacation time. You need to take it. It's important. I know sometimes the work is more when you get back, but it does help you to recharge. And remember that social connection is extremely important. Maintain meaningful relationships. And when all else fails and the stress becomes overwhelming, seek professional help. You need to develop resilience. I don't know why I said resistance before, but it is resilience. By building resilience, you can sustain your passion for taking care of your clients, maintain your emotional health, and continue to perform at your best. Investing in resilience at both the individual and organizational level is crucial to the long-term well-being of healthcare providers and the quality of the care they provide. To build and strengthen resilience, develop self-awareness. We talked about that with emotional intelligence. Regularly check in on your own emotional and mental state. Practice self-care. Physical well-being is a cornerstone of resilience. Build a support network within your workplace and beyond to create a sense of community and solidarity. This will decrease the feeling of isolation. Having colleagues to confide in, share experiences, or collaborate with can significantly improve emotional resilience. Resilience is not just about surviving stress, it's about growing from it. Actively engage in critical thinking, ongoing education, and peer collaboration, which can help you feel more equipped to handle the challenges. Take time for reflection. It can help you learn from difficult situations and find meaning in your work. And encourage a healthy work environment. While individual resilience is vital, organizational resilience also plays a key role. And with that, I will say thank you for listening and for learning from us. And I guess I'll go back to Rachel and see if there are any questions.
Yeah, thank you, Dr. Campagna, and thank you, um, Miss Lee Riley as well. This has been a great session. We have had several comments, but then we did have a few questions that I'd like to go back to. Um, if you can. So some of these may go back to some of your earlier presentation slides, but one of the questions was regarding kind of divine ethics. And this individual had a question regarding their mission at their hospital. And their mission is it's to pioneer a unique approach of healing the body, mind, and soul by applying best global healthcare standard and pursuing divine ethics. Do you think, based on your experiences and expertise, do you think that divine ethics are best to be applied in healthcare?
Divine ethics to me sounds like ethics of care. And yes, I do believe it is because we have to consider the individuals that we work with. We have to consider the people that we take care of. It's important for us to understand that what happens is not outside of the realm of the person that we're working with. Deontological ethics says to me that there is one right way of doing things. That's it. It's this or not. It's black or white. When you look at divine ethics or ethics of care, because I'm kind of equating them similarly, you're looking at the context, you're looking at the person. Not everything is clear cut. And I think you find that in your own lives. You realize that, sometimes it means doing something that might be ethically incomprehensible to you or unacceptable to you. The person who's extremely hungry that goes out and steals a loaf of bread, is that really deontological ethics would say, nope, that's wrong. It's absolutely wrong. But for the person who's so hungry that they haven't eaten in days, stealing a loaf of bread is something that's going to give them sustenance. So do we look at the compassionate part of that? Do we take that person and, berate them because they did that? Or do we try to make something better and maybe give them an extra meal? Find them a meal. There's a reason for why they stole the loaf of bread, and it's probably because they were hungry. So maybe we need to look further at what the reasons behind it are and become compassionate. In healthcare, I think we have to be compassionate. We have to understand that not everybody has, good health. Not everybody that's in our care is able to do things for themselves. How do we help them to do things or to get the things that they need without making them feel like they're less of a person or less of an individual? How do we provide empathy for them so that they can feel that we truly do feel what they're feeling. I do believe that the ethics of care is very much related to healthcare and very much should be applied in that situation.
Thank you. What about ethical obligations? What do you think ethical obligations do providers have if a patient leaves, say, AMA? Is having the patient complete AMA paperwork enough, or is there further obligations?
So, and I'm probably sure that Lorna is probably going to want to jump in on this one as well.
Sure.
This is a challenge. This is a real big challenge because the hospital says, well, when they want to go AMA, they sign the paperwork and then they're responsible. Do we
Mhm.
have a responsibility as providers? Do we have a responsibility as compassionate people? It's a conundrum. It really is an ethical dilemma. And the question is, how do you resolve it? Think about some of the ethical um, principles. How do you apply them in that situation? And maybe it's not a question of um, being able to provide the ongoing care. It's a question of maybe can we get them, can we refer them somewhere else or can we make sure that they're going somewhere else? We may not always have the opportunity to do that. But remember, autonomy is very strong here. Autonomy means I have a right to make a decision. My
Correct.
decision doesn't have to be what you think is right.
Exactly.
So if I'm making a decision that you think is bad, I have to respect your right to make that decision and maybe give you some ideas as to what you might be able to do after you leave here or other alternatives of what you might look into. But maybe I can't set up home care for you. I can't give you medications to go home with. You do what you can within the framework of the organization that you work in, but somebody's going AMA. They have a reason for why they want to do it. It's their choice.
If I
Lorna, do you
may,
have anything to add?
yes, that's a very good question. So in that scenario, it's crucial for the provider to ensure that the patient understand the risks of their decision, why they're AMAing, and if there's any indication that this person may not have the capacity to make that informed decision, there are there are structures within the healthcare system. Each healthcare system has their own structure as to how you go about addressing that. So when that patient sign AMA, it is clear that they understand the risk of their decision because they are outlining the risk and the benefits, that their ability to make that decision has been determined, that they have that capacity, and if necessary, to put in place services for that individual upon their leaving. So this is one way of still following through on that care of ethics component that was just discussed by acknowledging that person, that they have the right to make their own decision, that they have the right to autonomy, but that doesn't relieve us of making sure that we put in place services that can address the needs. It's up to that person whether they follow through on those services, but it still sits with the provider to make sure that the services that that person may need is put in place and is communicated to the person who's AMA. I hope that answers the question.
Thank you. We do have a few more questions I'd like to get to since we have about 7 minutes, but before I get into those questions, I know there's lots of comments in the chat regarding CE. So if we could just pull up that CE slide real fast for those that are interested. Okay, so for those of you that are on and looking for CE credits, we have 1.5 continuing education credits from the following accrediting associations or CE providers that you see on the screen here. There are several of them. So please make sure that you go to the event page where you've registered, where you found today's PowerPoint slides, where you found all the information today. Go to that page. I'm going to post that link again into the chat so that you can receive CE credit. Now, you will be taken to a purple continue education button that you see here as an example on the screen. From there, you will take into a survey. You must complete the survey in order to then be taken to identify which CE offering you are interested in. Trina, yes, board certified patient advocates is one of these as well, and it is not listed on here. I'm sorry. The event page has all of these listed, all of the CE offerings that are listed on the event page. I've posted that link in the chat. Make sure you go to the continuing education section of that website. You will notice a nice purple button that says continuing education. If you don't see it, make sure to refresh your page. There you will be taken to a survey, which you will complete and then identify which CE offering you're interested in at that point. All CEs will, you will be sent a certificate via email. If you have any issues with receiving your CEs, I'm posting my email address in here. Send me an email. I'll help you if you have any tech issues, but all certificates will be sent via email. I'm trying to think if I'm forgetting anything. Yes, case management certification is one of those CEs in that offering. The link to CEs is on the event page. I've posted that link here as well in the chat box. So please make sure you go to that event page to receive information on CE credit as well. You can also download the PowerPoint slides. Um, Send me an email if you have any questions. I've posted my email address in the chat. All right, so I'm going to try and get back to a few of the questions that we didn't get to get to. And then if there's CE questions in the chat, I'll try and answer them while the presenters are responding to a few of the questions that have come through. All right, so another question that we had, and one was a comment about recommended books. So Dr. Campagna and Miss Lee Riley, I will get with y'all after this. And if you have any books or recommendations for participants, we can get those added to the event page after today, if you have
That's
any of
good.
those. The
And I'm sorry, Rachel, but there was also some references at the end of the presentation. So if you've downloaded the slides, you can get those references as well. And I am going to now click the link for that empathy versus sympathy video that I mentioned. It happens to be wonderful. It's less than 5 minutes long, and it's really very interesting. I actually encourage you to look at it.
Okay, thank you. All right, so one of the questions was regarding boundaries. Is it ethical to tell the client that there are boundary problems? If we notice that boundary violations are happening on either end, how much of that needs to be explained to the client, or should we just quietly try to correct the course of action?
It depends. If if it's happening in real time, it depends on what the boundary violation is. If it's a personal boundary violation in terms of space or touching, it's really important to reset the boundaries requirement there. If it's something more subtle, and you're unsure, you may want to have a conversation with a colleague or your supervisor to say, "Hey, this happened during the session. I think it might violated some of the boundaries. Can we talk about it and see if my perception is accurate?" And then come up with a plan to address it with the client the next time they have an engagement. So again, it really depends on what it is. Some have to be done in real time to protect both you and your client. When the client is, because people will try and stretch the boundaries. They will push the limits of the boundaries. This is why it's important for the provider to be very clear, outline those expectations in the beginning, and sometimes even at each meeting to reiterate what the expectations are for both the provider and the client. But it is important to address it. And most people will hear it. I think it's how it's addressed, not whether it's addressed. So when I talked about with sensitivity, addressing it with sensitivity, it's using It's using your communication skills to to let the client or the caregiver know, hey, what happened last week, and explain what happened. We need to be mindful not to allow that to happen again. This is how we will need to proceed going forward. And I think people will be respectful of that.
Thank you. What are some strategies that you might have for reading the room or developing social awareness?
Very good question. Whenever I walk into a situation, I always go with an open mind. And I glance at the room. I look at who's in there, what they're doing. Are they sitting? Are they standing? What is their body position? Are their arms folded? Do they look tense? Do they look relaxed? Do they seem angry or do they look upset? Nonverbal cues, when you walk into the room, read those nonverbal cues. If your spidey sense is telling you something is off, trust your spidey sense if something is off. If you walk in and it's tense with anger, sometimes to diffuse it, you can just say, hey, I noticed that you might be upset. Can you share with me what is upsetting you? And when you do that, it's letting that person know that you are recognizing, acknowledge, and validating. The validation is crucial. You're validating how they're feeling. And if they are, they're going to tell you why they're upset, or they're going to tell you why they might be sad. Typically, when you walk in, it's that atmosphere of tenseness that you feel. Acknowledge it. Don't dismiss it. Acknowledge it. And once it's diffused, then you can go into your discussion. And sometimes it means you may need to leave the room and address whatever is causing the issue before you can get into your conversation as to why you're there. So reading the room is very crucial.
Thank you. We had some last minute questions that we weren't able to address, but hold the phone because what we will do is we will provide these questions to our subject matter experts and we'll post those questions or response to those questions on the event page where the PowerPoint slides are, the recording's going to be held, where all the CE information is. We'll go ahead and post those responses that maybe we didn't get to on the event page after today, because I know that we've reached that top of the hour for our time allotted today. But I really appreciate everyone for being on. Lots of great questions, lots of great comments. I especially am glad that you were able to share amongst your colleagues that are on in that chat with questions or comments or things that you can relate to. So I appreciate that. Thank you so much, Dr. Campagna and Miss Lee Riley as well for the presentation and your expertise in this area. Note that today's session is recorded. So if you need to go back and you missed something, or you want to share today's webinar with someone else that might be interested or just needing CE information, today's session is recorded. So please come back to it. Give us about one business day to get the recording posted on the event page, but we'll make sure it's up for you. Reach out to me. I've posted my email address in the chat. If you have any questions or just need additional support or information, I'm happy to help in any way that I can. As we close out today, I just want to also just bring to your awareness next month's webinar for our Lifespan Caregiving Group is on April 2nd at 11 a.m. We're going to be talking about TRICARE Echo, demystifying the program, talking about eligibility, enrollment, and support strategies for providers working with military-connected populations. So stay tuned and join us. And get connected with OneOp.org in general. We have lots of great programs going on between family development, nutrition, personal finance. Get connected with us on OneOp for all of our programs and information from lots of subject matter experts across the arena to support military-connected populations and those outside the installation gates as well. So again, thank you. Have a great rest of the day, and we'll be talking to you soon, hopefully.
Rachel, thank you for this opportunity.